We understand and consent that the following information will be gathered and utilized for educational purposes by Indiana Wesleyan students. We allow this information gathering and a physical assessment to be videotaped and posted on Blackboard for access by faculty and students at Indiana Wesleyan University. The video will be deleted by the student as soon as it has been reviewed and graded. We further acknowledge that this is for educational purposes only, and the information is not meant to be diagnostic. Therefore, Indiana Wesleyan University, the faculty, and staff, as well as the student, are not considered liable.
We understand.
We understand.
Okay, come on in, Mrs. Kellum. Have a seat.
Thank you.
Okay, I'm Shauna. I'm going to be your nurse today. And before the doctor comes in to talk with you, I'm going to assess you and do some short, quick assessments on your motor skills and such for today.
Okay.
And we're going to go over quick history. You are 63 years old, and you have a small history of high blood pressure. You've had shingles, which means you've had chicken pox. You have had a couple surgeries, a hysterectomy, a cholecystectomy, and you've had a gastric sleeve. Is this correct? Is there any other thing that I need to note?
Just knee problems here and there.
Okay. Have you seen a doctor about that?
Yes.
Okay.
The nurse is examining the patient as she is walking into the room. She is looking at her facial expressions to see if there is any reduction in her expressions. The nurse is also looking for movements that stop abruptly. This can happen to a Parkinson's patient when they are turning or going through a doorway. Now let's listen in.
Okay, Mrs. Kellum, it's been 3 months since you've been here last. How have you been doing?
Been doing pretty good.
Okay. Any new problems that's developed?
Not really new problems. It's just if I forget to take my medicine, my toes curl. So I have to be pretty rigid on making sure I get the medication every 4 hours during waking time.
Okay, is it both sets of toes on
No,
each feet?
just my right.
Just your right. Okay. All right. It looks like the technician today has taken your vitals. They were 125/80, your blood pressure. Your heart rate was 75. You have no temp, it's 98.5, and your respirations were 18, so everything looks really good there. And as far as your medications that you're taking, you're on Cinemet, which is carbidopa-levodopa. How do you recall why we put you on this medication to begin with?
I was complaining that I had no movement in this hand. I could put my hand up like this, but I couldn't do this. I couldn't wash dishes. I couldn't do this to wash a counter. I just had very limited usage of this hand.
Okay. Was it you just couldn't put very much pressure?
I just couldn't make it move.
Just couldn't make it move.
I could just do limited movements.
Okay. Since you've been on the medication, is it helping with that symptom?
It helps with that wonderfully.
Do you feel like both hands are equal at this time?
Yes.
Yes. Okay. Okay, now we're going to talk about your energy level. Have you noticed a drop of your energy level, or is it about the same?
It's really improved since I started the medication. What I always assumed was just me being slow, actually, I think had a lot to do with the problem. It was kind of like the whole right side of my body was just in a slow mode.
Okay.
But now, since I'm taking the medication, I'm quicker.
Okay. All right. I was wondering if you could write your name on this piece of paper for me.
The nurse is asking the patient to do this to check if it is smaller than her previous signature. Parkinson's patients tend to write smaller and more spiderly.
Okay.
While talking to the patient, the nurse is also looking for her speech qualities. Parkinson patients' volume become reduced. This is hypophonic. Their speech also becomes more monotone.
Okay. Mrs. Kellum, do you have any problems with your sense of smell?
I don't really think I do.
So
I haven't noticed anything.
So when you're going into a restaurant, you still smell the nice aroma of the pleasant foods?
Mm-hmm.
Okay.
Sometimes patients can develop this during the process. This is called insomnia and anosmia.
Okay, now I'm going to check for rigidity. I would like you to take your arms and hold them out. Okay, and then back down. And then hold them out again. Does that feel like a nice natural movement to you? It looks very well.
Mm-hmm.
Okay.
Patients don't like to hold their arms straight, and it is the opposite with their legs. They like to have them extended.
Okay, can you take your legs and hold them out for me? Now flex them in as tight as you can. Does that feel uncomfortable at all?
It does on this leg, but like I say, I have knee problems, so this leg doesn't want to go as far as...
So you think it's the knee more than it is the actual flexion?
I seem to think it is.
Okay.
But
Okay. All right, you can relax your arms and legs now.
As you see, the patient is showing signs of spasticity. Once a Parkinson's patient unfreezes, they often cannot stop moving.
Now, let's check for dexterity. Can you put your thumb and your finger together like this? Do it quite fast if you can.
During this test, the patient's movement slows significantly if Parkinson's has progressed.
Okay. Now, Mrs. Kellum, do you mind walking across the room for me to the door and back?
The nurse is looking to see at the patient's gait to see if there is a reduction in the arm swing, reduced length of steps, a shuffling gait, hard to initiate the walking. As the nurse writes her notes on the chart, we can watch to see if there are any tremors present in the patient. This is present in many Parkinson's patients.
Okay, Mrs. Kellum, is your weakness that you spoke of earlier just specifically on the one side? It's never went to the other side?
never.
Okay, and which side did you say it was?
It's my right side.
The right, okay.
This disease always starts out one-sided.
Okay, now we're going to examine eye movement. I need you to follow the movement of my pen.
Eye movement should be smooth. When there is difficulty with up and down movements, this can mean reading and focusing are occurring. This is a very common complaint in Parkinson's patients.
Okay. Okay, now we're going to look at the nose finger test. Okay, I'm going to hold my finger up and I want you to take your finger and touch your nose and then touch my finger back and forth.
The Parkinson patient is usually very accurate at this, but very slow.
Very good.
In Parkinson's disease, we are basically looking for movement that is slowed. Is there tremors and is it one-sided? Once this has been determined, we can try medications to see if they are effective. If they are, we usually have diagnosed properly.
Okay. Our next step is to see the doctor, but I believe that we're on the right track of monitoring your disease process. We will see you again in 3 months unless you have any further problems before then, and then you can call us sooner. And I want to thank you again for coming in for your visit today.
Thank you.